Behind the culture, traditions, masks, and music, Asian and Pacific Islander communities in the U.S. are struggling with mental health issues and often not getting the needed help. Gregory Sandana is a board member at the Asian Mental Health Collective. What are the unique mental health challenges facing Asian Americans?
Asian Americans are 50% less likely than other racial groups to seek mental health services. And Asian American young adults are the only racial group with suicide as their leading cause of death. And so mental health is a critical issue.
Other communities deal with the same issues, but there are specific pressures Asian Americans face, including the so-called model minority myth.
The myth that Asian Americans do really well, that is not the complete story. There are many folks who struggle.
Living up to the myth can create stress that contributes to mental health issues, and asking for help can bring on feelings of shame. In recent years, Asian Americans have faced additional traumas.
I'm fed up feeling like we have to be the model minority to some, and then to others, we're marginalized.
Former President Donald Trump repeatedly blamed China for the COVID-19 pandemic, which his critics call racist. There have also been a string of disturbing hate crimes targeting Asian Americans.
Since the beginning of the pandemic, there's been more than 11,000 reports of incidents against APIs across the country. This anti-Asian hate and racism came from scapegoating, came from xenophobia, which continues to negatively impact the API community, and I think further puts, our mental and physical health at risk.
Nếu bạn cũng trải qua những cảm xúc như vậy.
In Los Angeles, public service announcements target Asian Americans in a variety of languages. Advocates say there needs to be more public outreach like this, plus more Asian American therapists and mental health professionals that are culturally compatible with Asian American and Pacific Islander communities. But perhaps most of all, there needs to be open dialogue. As a Filipino American, Gregory Sandana says growing up, he wasn't encouraged to talk about mental health issues. But now he openly talks about his own struggles and the help he has gotten.
To say, look, it's important for us to name the challenges that we're facing, to name if we need resources and support. And so I'm hoping that as I share my story, as more folks in the Asian Mental Health Collective share their stories, that people could see what, could reimagine what's possible and to know that their mental health matters.
Jim Spellman, CGTN, Washington.